Honorable colleagues, on 24th of July, we had a business committee meeting where we approved the parliamentary calendar for this session. And the Prime Minister, leader of government business in the House, presented the legislative agenda of government, and we were able to adopt it, and therefore we shall be following that legislative agenda to ensure that indeed we finish most of the business. And it's against that we are always assessed, because it's our work plan as a House. So when they are assessing our performance as a government, they look at how much we have been able to achieve in terms of the legislative agenda. I will request the clerk to share, to upload it on our system, so that all of you honorable colleagues are able to look at it, so that you schedule your programs very well. It includes the recess, where we have oversight, where we have the budget and all that. The leader of opposition had raised the issue of the legislative agenda from the opposition side. I told him to, well, in our rules of procedure, it's not directly provided for, but under Rule 53 of our rules of procedure, he has all the power and all the time to present such issues if he wants them to be presented on the floor. Honorable colleagues, I have received several complaints from medical intern students. Most of them have bombarded my social media accounts, and we know also most of them in the public, because some of you pay for some, or you have at least people from your areas, so they have very many issues. And this issue of their deployment, of their delayed deployment, it's a thorn. It's a thorn for us, and it's been happening year after year. And then we say, but we have very many professional bodies. How come it's only medical interns who are not, who usually have such issues? What is the problem? Is it the issue of funding? Is it the issue of facilities? Is it, it's an issue we need to tackle. We need to come up, and we work together as a government, and we ensure it is sorted. Because if you're telling these interns that you're giving them another year at home, without anything, I've done my part, I've finished the studying, but you are saying I cannot practice until I do internship. But then you're not taking me for internship. So what do I do? And most of them, you remember, they lost a lot of time during COVID. They've already lost a lot of time during COVID. So I know many colleagues had also raised this issue with me, and I think the right way should be that the Minister for Health on Tuesday brings a statement.